name is Cammi, I'm 15, and I'm fighting a war. I like writing, drawing, eating, learning, hanging out with my friends, creating and crafting things, and playing volleyball. A little over a year ago, I realized that something was really wrong with my body. I recently started menstruating, and my cycle was extremely painful before, during, and after my periods ended. I thought this was just what girls had to deal with, and I was just being a wimp and I had to get over it, but I turned out that it wasn't normal, and I missed a lot of school, several weeks, and I was just lying in bed or on the couch, and I was doubled over with debilitating cramps and burning pain and nausea, and I was just waiting for it to go away, and it didn't. I seriously thought that I was dying. I met with an OBGYN doctor, and it turns out that I have endometriosis, or Endo for short. And it's a disease where uterine cells that are supposed to develop inside of your uterus develop outside other places, and they attach to your organs, anything that they can get a hold on, and then they blister and burst, and it causes severe pain and bleeding inside of you and scarring. They aggressively spread like tiny poison oak, and they can't be gotten rid of without surgery. They react to hormone surges, which is why during my periods they were worse and I suffered a lot of pain. My doctor decided to give me an injection that would stop my periods and the pain, but it didn't stop the pain. My mom and I researched endometriosis, and we found out that not a lot is understood about it. It's really underdiagnosed because it can't be tested for in a blood test, and it doesn't show up on a scan or an ultrasound, and it can't be 100% officially confirmed without exploratory surgery. Many doctors have misdiagnosing it in their patients because they dismiss it as just she's making it up, or it's all in her head and she's making a big deal about it when she shouldn't be. So even if I do get the pain under control, it doesn't stop the endo from growing, spreading, and damaging whatever it touches. I have dreams of going to college, getting married, and having a family of my own someday. If the disease is left inside of me, it will jeopardize my ability to be able to do these things. And it can potentially damage my reproductive organs so that I couldn't even have children. It could damage my other organs too, which could lead to other health issues later on and would prevent me from maintaining a healthy, active lifestyle. In order to get rid of my endo, I need surgery, and that will help prevent further damage to my body with the right kind of tools by somebody who knows how to use them effectively. I found a doctor who can, but he isn't covered under my health insurance, and he knows what to do to help me heal and get better, but it comes at a big price. It will cost $25,000 for the hospital stay, follow-up visits, pain meds, and lab tests. For my 16th birthday, I want to be pain-free. I want to be able to go back to high school and play my sports and hang out with my friends again. My goal is also to raise awareness about endometriosis by telling my story. My hope is that if enough girls and women become aware of what endometriosis is and what it takes to treat it effectively, they'll speak up about it instead of just putting up with it. They'll demand more of their doctors, which hopefully will eventually change their options for good health care and make getting well available to everybody.